Okay, here we go.
Here we go. We are live. Hi, everyone. Happy Thursday. Thank you guys for joining us for another session of Back to Basics. This is Okoye of Wakanda versus Hua Mulan. My name is Dr. Vivian Asamoah, and with me this evening is our wonderful physician assistant, Dona Lee. And nice to see all of you guys, and welcome to Back to Basics. We do these live streams every Thursday at 6:30, talking about a different GI topic, anything related to natural gut relief, anything related to new information we can learn about how to treat the gut and restore the gut microbiome. So as a gastroenterologist and a gastroenterologist physician assistant, we see a lot of H. pylori, right, Donna?
Yep, we do.
We see a lot of it. We see a lot of it. We treat a lot of it. We get a lot of referrals. And as our practice has evolved with a lot more integrative and functional medicine, we sometimes have to go back and look at the conventional GI treatment and more natural and holistic approaches, and really kind of figure out which one is best for which patient, okay? So we're diving straight into this, but we wanted to welcome all of you for joining us tonight. If you can hear us, please put in a like, put in a comment, share some love. If you know anyone who's had H. pylori, who is struggling with H. pylori, and would love to listen to this, please go ahead and share the post with them. Thank you. Excellent. We're seeing some responses. So nice to see you guys. We want lots of questions because we have done our homework as usual. Donna was like on PubMed a second ago, looking up stuff, you know.
Gotta be prepared.
Huh?
I gotta be prepared for you.
Yeah, the latest data. And so, I mean, today I think you got the easy one because you're doing H. pylori as a foe, and you want to eradicate and treat. And I'm doing H. pylori can be a friend, and maybe we don't have to treat all the time. So Donna, I'm gonna turn over to you. This is a friendly debate, guys. So you're gonna start off telling our family a little bit about what is H. pylori and why do we need to treat.
This is actually a topic I really like explaining. I kind of make it fun for the most part. So H. pylori is, the way I describe it for a lot of our patients is that this is a stomach bug that lives in our stomach. All it does is just make acid, pumps up all of these acid out. Patients actually come in and they say, my reflux is acting up. I get a lot of burping. I get abdominal pain. And then sometimes vague symptoms could be just, I just only feel bloated. So whenever we have GI symptoms, we want to screen for H. pylori. And usually the typical testing that we would start off with is doing an upper endoscopy. And we take biopsies, random biopsies throughout the stomach because they like to hide in the nooks and crannies of our tummy. And we also do stool testing or a breath test. So breath tests and stool tests, you have to just be careful. A lot of times they could be false negative. And so upper endoscopy is actually a lot more accurate in a way. So with H. pylori, why do we care so much about it? It causes symptoms. But for me, the reason why I like to treat is because I know that there is some increased risk factors. This actually comes with stomach ulcers as well as stomach cancer. Now, Dr. Sama really wants me to really put in the statistics, give us some numbers to help make us understand, well, how important is it and what is our risk for this? So actually in the United States, 35 to 40% of the population has H. pylori, but only
like the average population, like counting everybody.
Everybody, yeah. On average,
that's a lot.
Yeah, we're walking around with 35-40% of our patients that could have H. pylori, but only 20% of them actually develop into GI issues, GI symptoms.
Oh, okay. So this could be symptoms that range from just like reflux all the way down to like ulcers?
Exactly.
Okay.
Yeah. Okay. And then like that small section, 10 to 15% may not even know they had it and we found it. Yeah. Okay. So, and we'll get into that kind of debate, whether or not we want to treat. So a lot of risk factors. So why did I get it? Where did it come from? It some risk factors actually includes like heavily dense populations, overcrowding in cities, poor hygiene, or poor sanitation, and actually growing up or visit a developing country. So those are your risk factors. They actually had seen, and I actually wanted to compare this to, antibiotics risk, because that's going to be coming later, why it's going to be a little bit harder to treat. And actually, I found this interesting fact.
You're taking my jacket off. I'm getting ready for the fight.
I know. All right, take your earrings off.
My earrings off.
So we see a lot of antibiotic resistance in Galveston area. We're actually one of the biggest 4 cities that they've seen this on the CDC website. That's what they kind of mentioned. Galveston, yeah.
Do you know why?
Oh, I mean, I can imagine it's because of how densely populated and its feed, like the water, refineries, things like that, poor sanitation. I think that's all contributing to it. But yeah.
So that's a lot. That's great information, Donna. So you're saying about in the United States, 30 to 40%, you said 30 to 35% of people, healthy people, have H. pylori. Like
they're just walking around with it.
Positive, right?
Yeah.
I know that the numbers are as high as 60% in the world.
Yep.
Okay. 60% of the world population are walking around with H. pylori. Now let's go back. That's a lot of people. That's a lot of people you would have to eradicate, right? But let's go back to the United States. You said 30 to 35% have H. pylori. So it's like 3 to 4 in 10 people have H. pylori. But in those 3 people, only 20%? Right?
Yeah.
A quarter of them, so even smaller percentage actually have symptoms, right? The symptoms that can range from heartburn or whatever. I mean, all of that stuff, right?
Yeah.
So we'll go into symptoms a little bit, but I wanted to bring one fact up because we see this commonly in clinic, right, Donna? The testing for H. pylori. So we talked about the breath test, which is an easy test to do. That's like the first test to do. It's easy. I want to just get everyone's attention and get our crowd engaged for the fight. So if you want to put in a comment, just put an H. pylori in the comments so we know that you guys are engaged and watching or joining us soon. Please go ahead and share some love. So it also keeps us pumped up for this conversation. We've done a lot of research. So we have 4 different ways of testing, actually, but you actually completely eliminated one of them because the American guidelines American Gastroenterology Association is actually saying, don't do that test anymore.
Yeah, I know what you're talking about.
Yeah. And the labs like Quest and LabCorp sent out memos last year to say, we're not even offering this test anymore. And that is the
blood antigen antibody.
Yes,
right?
antigen antibody test. Whoop whoop. We're seeing a lot of people on. We are H. pylori all in the house. Right? H. pylori in the house. So because that test could be a sign of an old infection, right?
Yeah, it's hard to tell to know if this is active. Yeah.
So that test is non-valid. Don't use it. Don't go buy it. The test that you really want to watch out for is, like Donna said, the stool test, the stool antigen testing, the breath test, which is very specific, and then the upper endoscopy if we need to. And the breath test, you said, sometimes can lead to false negatives if people are maybe taking acid blocker medications, Pepto-Bismol, it can give us false results, right? So sometimes that's why we have to go to the endoscopy. Okay.
Yeah.
Got it.
All right. So now I'm going to reframe a little bit of the cancer risks for H. pylori because I mentioned about how it can develop into stomach cancer. So now if we break it down, they said it's about 1 to 3% of infected individuals can develop into stomach cancer. Now let's compare this to smoking, right? Smoking is a direct correlation. They said that's actually up to as high as 80 to 90% leading to lung cancer.
Wow.
Yeah. Big extreme, I know.
Big extreme, right? Big extreme. So, okay, so 1 to 2% of that already small percentage, that 20% of the 30% have it. So we're diluting this even more, right?
Yeah.
We'll go up and develop stomach cancer, right? I think maybe a higher number may develop peptic ulcer disease. What did you see anything on that or not much?
I didn't see too much. I think a lot of it's more focused on
cancer.
Yeah, but at least I'm going to say 20%. We don't know how much of the 20% of the GI complications is more ulcer.
Okay, so this is really interesting, guys, right? So looks like a very, very small percentage will go on to developing cancer. But I've been in practice for a decade. Donna, you've been in practice for half that time, 4 to 5 years already with me. How many, we've seen tons of H. pylori as GI specialists, right? How many cancers have you seen?
I'm going to say a handful.
No.
To me, yes.
Have you seen a handful? Yes, maybe.
Yeah, that we diagnosed.
Related to H. pylori.
Yeah.
Yeah. So a handful, that's less than 5. That's like 5, right? We've seen thousands of H. pylori.
I know, yeah. So H. pylori back to back.
Less than 5. So, the numbers we are seeing in clinic really fit the statistics, right? That 1 to 3% is a very, very low amount. And our numbers are skewed because we see GI diseases all the time. We're not in the average population. Okay. All right. So you guys, if you have questions, please share your questions with us. We're just kind of digging into the literature so that we want to emphasize, the incidence and the risk of the disease. So who would you treat? According to the American Gastro Association, right? They came out with guidelines recently. Who must be treated?
They said anybody who has active ulcers definitely want to treat, because that's the direct cause from H. pylori. We also want to treat with anybody who's symptomatic, and even with young patients, there's certain reasons when to treat, but mostly it's anybody who has any active ulcer disease, definitely you got to treat.
Okay. And then, of course, if there's cancer, because some of the cancer, like the multiple lymphoma, which is a type of lymphoma associated with H. pylori, sometimes can be reversed if caught early, right, with the antibiotic treatment, right?
Right. Yep.
Okay. So anyone who's symptomatic. Okay. All right. And then how are we treating these days? Like conventional treatment for H. pylori?
I mean, I tell my patients, this is a stubborn bacteria. You definitely need to make sure you take all your medications. They come up with like at least 4 different regimens that we got to pick from. But still, the first line is going to be that quadruple treatment, which means 2 antibiotics, which is metronidazole and tetracycline. You can also sub it with doxycycline just in case there's any allergies. We do another PPI, which is omeprazole, pantoprazole, and as well as a bismuth, which is Pepto-Bismol. So all 4. So you can't miss the dose. That's our slogan whenever we're starting to treat.
Oh my gosh. I mean, that's like, so it's 4 different medications.
Yep.
The range can be between 10 and 14 days.
Yep.
And you forgot to say that with that protocol, which is the modified Pylori protocol, because we give everyone the generic version because it's much cheaper, it's 4 times a day. So they're literally waking up like every 6 hours. So it's like 6 a.m., midday. Yeah. Hi, guys. So good to see you guys. Please put in questions. Please definitely put in questions. So these, for treatment of H. pylori, I want to emphasize that the old treatment of that prep pack with amoxicillin and clarithromycin is old school, right? We don't do that anymore because it doesn't work, because the bacteria has so much resistance. So we at our practice use the CDC guidelines based on our area, the incidence of H. pylori in Houston and Texas area, which is actually really high because Galveston is one of the highest places. There's a lot of resistance. So we have to use the newer recommendations, the newer protocols. And so this is like 4 different medications, 2 antibiotics every 6 hours. I mean, it's over like 40 pills. It's like how many?
Yeah, we even make a little grid to just kind of tally mark, make sure you don't miss a dose, right?
Yes, it's tons of pills. I think by the time you finish the 14 days, you would have taken like over 120 pills.
Yeah.
Right. Okay.
So that's first line.
First line.
You have actually this new treatment that they use, rifabutin, as well as amoxicillin and omeprazole. And actually, there's a lot lower risk of antibiotic resistance with amoxicillin, interestingly. So I think that's why they use amoxicillin more as a secondary treatment in case the first one has failed.
Okay. And we're using quite a bit of that as well in its generic form. Okay. All right. Awesome. So we got the treatment down. What questions do you have for me?
All right. Well, I actually wanted to know, well, what kind of treatments would you do as alternative options if we don't want to do antibiotics?
I think that, if we're not going to do antibiotics, what I've learned from doing this research over the last couple weeks, and even as I kind of dove more into functional medicine, is that as a gastroenterologist, I realized there are probably two types of H. pylori infections. I think that there's an acute infection, and those are the patients we see who are like, I was fine, I'm fine, and all of a sudden I started burping, I have stomach pain, I have reflux, and you do an H. pylori breath test and they're positive, and that for me is an acute infection. And you treat them and right away they're great, they're fine, right? Or they may even have ulcers and you treat them and right away they're fine, they're good. And then I think there's a more chronic H. pylori that we don't really talk about or we're not trained about in conventional GI. And this, I think, is the benefit of doing the detailed stool testing, right? The comprehensive stool testing that we do that actually looks for the DNA, because H. pylori, like other bacteria, is supposed to exist in the gut, right?
Right.
But it's in low quantities, just like how people get dysbiosis and SIBO. I hope you guys are sort of following along what we're saying. We're talking about H. pylori bacteria, and we really think there are two forms. There's an acute form and a chronic form. And which one should you treat? And I agree with Donna in treating the acute form right away. But the chronic form is almost like somebody getting bacterial dysbiosis or SIBO. It's overgrowing because of something else going on in the system, like the microbiome is off. And the only way to really know if that chronic form is there, I think, is by doing the stool test, the comprehensive stool, the right stool test, because not all stool tests test for H. pylori.
Right.
The one we use really tests for the actual DNA levels of H. pylori in stool. And it actually looks at the different strains of H. pylori, because you can have multiple different strains that are either very aggressive, which we call virulent. The ones that are virulent are the ones that are going to cause a lot more GI symptoms, stomach cancer, peptic ulcer. And the ones that are less virulent are the ones that are just kind of hanging around in the gut, living in harmony with the other bacteria, virus, or fungi, and doing good. So if you find high levels, because I posted on Monday a GI maps test of one of our patients. I will not say her name. I don't even remember who it is. But she has chronic gut symptoms, okay? And so when I posted her case, she had positive, higher levels of the PCR, but she didn't have any virulent strains. But when you say, does she have symptoms? She does, because she has tummy upset, bloating with meals. She has a little bit of reflux. She has extreme fatigue, and she has brain fog and poor attention. Now, would a conventional GI doctor call that symptoms of H. pylori? Not, well, the stomach stuff, yes, but the other stuff, not necessarily.
No, you wouldn't know.
No, you wouldn't.
Yeah.
But I will say this. I'm going to make this very personal. My brother-in-law had H. pylori, and his only symptom, I kid you not, Donna, his only symptom was fatigue and dizziness. That was it. He only had fatigue and dizziness. And I was like, what is wrong with you? What is this? And he was like, yeah, when I eat, I just feel like my food doesn't go down. But it wasn't reflux. It wasn't heartburn. He was just like, I just can't believe it. I'm so tired. I'm so dizzy, right? And, he actually did do a breath test, and his breath test was indeed positive. But those were his only symptoms. So when we talk about what are the symptoms of H. pylori, it's not just the gut symptoms, because we realize how much H. pylori affects the entire body.
That makes sense.
It is a bacteria, especially when it's chronic, So I did some more research. And I found a study that was published in the World Journal of Gastroenterology, which is a fairly reputable journal.
Yeah.
Of the extra gastric manifestations of H. pylori. So these are all the symptoms that H. pylori can cause that are not stomach symptoms. Okay, so it was really interesting. So from a lab standpoint, somebody may just have iron deficiency anemia. They may just have a mild anemia and it's H. pylori, and they have no GI symptoms, right? So we always test when someone has anemia, we always test for H. pylori, even if they have no stomach symptoms. Low vitamin B12 can be H. pylori as well, right? So it's now it's like affecting just even production of red blood cells and absorption of nutrients, right?
Right.
Low platelets. Did you know that there's an autoimmune condition called ITP?
Oh, I saw that. Yeah.
Purpura,
Yeah.
that is caused by H. pylori. Again,
That's
no
crazy.
GI symptoms. I mean, if you guys find this, I found it really exciting and interesting because I'm like, I need to be checking H. pylori in everybody. And so if you guys listening can relate, let us know some of the symptoms that if you have had H. pylori that you've had. But I was very surprised. Dizziness was on the research paper. Chronic fatigue was on the research paper, along with your traditional things of pain, nausea, vomiting, dyspepsia. But guess what? They've also found an association with inflammatory bowel disease, so autoimmune conditions. Skin disorders like rosacea, psoriasis have all been a bad breath. That was one symptom. But these have all been associated with H. pylori. So maybe these are the chronic forms of H. pylori that we should pay attention to.
Yeah.
And maybe we're missing out on patients who come to us with sort of chronic, maybe GI or just vague symptoms. It almost seems like you got to do a stool test in everyone and make sure.
Yeah, I mean, you got to test all these patients now. Like, every symptom you test them.
You got to test that microbiome. They even said some association with gallbladder disease, association with fatty liver disease, because the bacteria can go into bile, then go into the liver and cause issues there, right? So that will affect insulin resistant, like insulin sensitivity. Like it was crazy. I was like, wow. Well, I mean, anxiety is definitely one of our Facebook families is saying anxiety. We don't learn this in GI school. They don't tell us about this, but the data is there and the research is there, and they're quoting a lot of data about this. So this was really interesting. So when it comes to who has symptoms and when do you treat, it's now, well, what are you calling symptom?
And what are you calling type of treatments, right? Because you're saying all these symptoms, everybody should be tested, right?
Yes.
But also, what kind of treatment is going to be the right for the right person?
So when it comes to chronic inflammation, chronic infection from H. pylori, I don't think the treatment is, from a functional medicine standpoint, where we really differ with conventional. And I think, yes, guys, it's important to have the best of both worlds, because with what Donna said, if you go see somebody who doesn't know the data, who doesn't know the risk of gastric cancer, the risk of, developing other issues, and they just want to put you on supplements, it may not be the right thing for you, especially if you have a history of GERD, family history of stomach cancers. Like, you want to treat according to guidelines, right? But for those people who have kind of chronic symptoms, who you're finding this in, it's a comprehensive treatment. Remember, as we always say, if functional medicine doctors and integrative doctors just now start giving just supplements to everybody, wouldn't we be doing the same thing as, what we're sort of in some ways, pointing out that conventional medicine is doing too much of, I mean, supplements are prescriptions, right? So it has to be a holistic treatment, right? The focus really, we think that the H. pylori bacteria, which normally lives happy and, like a really nice person in your gut, a really nice bacteria in your gut, and plays nicely with everyone else, something happens to get that bug upset. And it could either be toxin, inflammation, it could be a medication, it could be NSAIDs like Motrinileve or Advil, because we know that people who take NSAIDs have a higher risk of developing H. pylori. And what are NSAIDs going to do? Motrinileve, aspirin, and Advil, and all those medications we take for heart disease that thin the blood, thin the mucosa, thin the gastric lining, thin the small bowel lining, and eventually will cause leaky gut. And that's going to change your microbiome, and you'll develop, SIBO, and H. pylori gets upset and now becomes an upset microbe causing issues. So dealing with taking away the aggressor and changing the diet, restoring the gut microbiome through healthy diet and nutrition, and reducing stress. So stress is a huge one. When we talk about stress, everyone always thinks, well, I have to be like upset, going through a divorce to get H. pylori. No, I mean, stress is in all shapes and forms. There's chemical stress, there's physical stress, and there's emotional stress, right? So one of the chemical stressors we mentioned was the medications like Motrelin, Advil. Yeah. And there's emotional stress, like you're truly going through a lot of stress, which affects the HPA axis, which are the adrenals of the system.
Yeah.
And there's physical, true physical stress, which can cause issues too. So really, from a functional medicine standpoint, in treating chronic H. pylori that is affecting the gut microbiome and immune system, deal with the HPA axis, the stress, focus on diet and nutrition, and then use your natural supplements to go through that 5R protocol, the repair and healing protocol. Which you want me to tell you what that is, right?
Yeah. I don't know what it is.
Well, you do use that protocol after you treat some of your patients with antibiotics. That's kind of what we do in our practice. Where after acute infection, we will use that. So the protocol is really, the studies have shown that things like mastic gum at a high concentration, manuka honey, DGL, deglycerinated licorice, of course, using probiotics and everything that helps heal the lining of the gut in terms of glutamine and zinc carnosine.
Yeah, we got to build up the barriers up, right?
Build up the barriers, exactly. So I have a question for you. If you had a patient with H. pylori and had no symptoms, would you treat?
I wouldn't. I mean, we always treat our patients, right? We have to kind of know, well, what's the point of treatment if we don't have any measure of knowing if they're going to feel better, right? What kind of results are we going to get if we, and also like the risk of what happens if we give them antibiotics, the stools, and also higher risk for C. diff, especially in our elderly population. So we have to really understand, even if we find it, and also looking at the risk factors of cancer, is it worth treating our patients? And I would say we got to treat our patients. If they are symptomatic, yes. If they're not, then I don't think so. But we can do different. Everyone's always going to ask, well, if I have it, then what should I do? So would there be alternate treatments or something that you would rebalance the gut?
I mean, it's, that's if they have symptoms, though, because I mean, if 30 to 35% of people are walking around and have it, and we've talked about every single symptom. So I'm asking this person, hey, if they have psoriasis and they're positive for H. pylori, for me, where I am right now in sort of my knowledge and understanding, I would treat the gut microbiome, because I would think that there's a bacteria that is potentially enhancing this immune response, right? So if they have like autoimmune issues, I would probably lean more towards treating. If I notice they have low platelets, low B12, low iron, I would probably treat. So I think that we have to do a better job at defining what is symptom, make sure we don't overlook a symptom like dizziness, which positive patients, now that we know, we're kind of advanced, we are 2.0 GI doctors, so we are learning more than we need to know, but we will treat.
Like your definition of treatment, I would be like, I wouldn't do antibiotics. I'm like, oh, I'm having dizziness. Like, no antibiotics. We actually want to restore the gut, right?
Yes. I agree with you. I agree. In that kind of person, you're looking more at treating chronically, right? Yeah. What are you eating? What are your stressors? What is the immune system like? How is the gut microbiome? And I would focus just on diet, nutrition, and natural supplements treatment, right? We have a question from someone. Is H. pylori contagious to animals like dogs? Is it true that dogs have their own form of H. pylori, and how are they treated? I have no idea. I mean, I'm sure dogs have their own form of H. pylori, and dogs.
They're dirty. They're dirty.
They're dirty, and this is it's supposed to be transmitted oral fecal and through dirt and whatever. So, yes, I would. We'll look that up. Can vertigo be a possible symptom? Yes, we just talked about how dizziness and vertigo can all be symptoms of H. pylori, so that should absolutely be checked out. But we are going to do our research about pets and H. pylori. We know the perfect patient to ask, actually, because she worked at a veterinarian.
We should pull her into this.
We should bring her into this, absolutely. So you kind of mentioned age groups, right? And children versus elderly. What's your take on that? Like
Okay,
what age?
so they said in young children, it's only worth treating if they actually have active peptic ulcer disease. And the only way you would know is actually if you did an upper endoscopy.
Okay.
So they said that's worth treating.
Okay.
Everything else, they said that, there's a lower incident rates for kids to actually develop, like,
H. pylori.
well, H. pylori, they may have it, but they usually are walking around with it and don't really develop too much of symptoms. So that's why I think if it's active, we do the upper endoscopy. If they're having stomach pain, we see ulcers, then we treat. But
Okay.
as far as if, because a family member have it and they might have it,
Yeah.
I don't think it's worth
So
treating.
if they have no symptoms, don't treat.
Yeah.
But if they have symptoms, treat. But then I kind of also learned from a couple of our functional medicine gurus that we're seeing more and more children with symptomatic H. pylori.
Mhm.
And maybe this is related to just the overall immune system, right?
Yeah.
Because if you imagine what our kids are eating, what kids are eating today compared to, what we were maybe eating before, we're eating a lot more processed, we're eating a lot more fast food. So their gut immune system is probably not as strong to fight it.
Yeah.
And we are seeing symptoms. So, I mean, there are lots of kids, if a kid has nausea, vomiting, a lot of heartburn symptoms, and they're showing up positive for H. pylori, I don't know why you would put them through endoscopy and all that, like a 7-year.
That's what they said. I
That's
think
a little bit hard. I would treat, and I would follow the treatment with, the whole diet change and restoration and everything. I would definitely.
Well, how compliant would they be, as kids?
Well, I mean, I recently had to prescribe treatment, and we did all the suspension, so the liquid formulation.
Okay.
So mom was kind of hiding this in drinks and, water and things like that.
Okay, you gotta be sneaky.
Yeah, you
Yeah,
gotta.
I wonder. Yeah.
You can do liquid formulation. So I think, there's a role to treat. There's room to treat there, but you want to be careful in changing that gut microbiome. What about older people? Older, like someone who's like 80 and has a bit of nausea and came with H. pylori. What would you say?
Well, I would treat, but I've learned that I have to weigh this very, very carefully.
Okay.
And it goes with age, and also as we get older, we are going to be a lot more higher risk for C. diff infections, and
Yes.
especially if we have chronic stomach acid suppression,
Yes.
and if we've had a lot of antibiotic treatment before, like with SIBO, it's going to put us a lot more at risk, and especially with patients who are older with a lot of comorbidities.
Yeah.
Then it may not be worth treating. We might want to kind of change what it is in the diet. Also, maybe use
go with a
probiotics
more
kind
natural
of
approach. Yeah. So the much older people, yes, I agree, going with a more natural approach. That we've seen some of our older patients with H. pylori get on this harsh antibiotic regimen and then develop C. diff.
Yeah.
Which is a different beast altogether. So that's also hard to deal with. We have some answers about the H. pylori. She found some information about H. pylori is a bacteria that infects the stomach and small intestines of dogs, cats, and people. So several species of H. pylori have been isolated from dogs and cats, but according to the vet manual, the significance is unknown. It's not sure how the bacterium affects animals, but we can assume that animals can transmit, as with those whole COVID thing that happened.
You just never know.
You never know. I think animals can transmit to humans, right?
Yeah.
And we could get that form, and then that could be an issue. Okay. What other question? We talked about treatment. We talked about symptoms. And you were talking about, we sometimes will see patients who've had H. pylori over and over and over again.
Yeah. Mm-hmm.
What do you think that could be related to? Why do some people it just never goes away?
Yeah, first off, and then also, like, is it worth retreating over and over again, right?
Over and over, yes.
So we always wonder, okay, first off, did the patient get all the treatment? Are they compliant? Did they follow in directions? Because that's going to lead to more and more resistance, leading to my next point, that are you being treated with the right regimen? Because oftentimes whenever we treat once and it turns out we retest and it's positive again, you wonder, okay, going through those questions, are they compliant? And then the second question, did they become resistant? because they have a history of clarithromycin, Cipro use, levofloxacin use that could be also contributing to resistance. And they actually came out with resistance panel testing. Now,
so you can check to see which antibiotic
and we can target
for that H. pylori and target the treatment. Okay.
Right. And also making sure, do we have the right acid suppression? Because that's why the first line has 2 antibiotics and 2 antacids, just to kind of expose the bacteria, suppress it long enough to be able to really get to it. And with the resistance nowadays, I think that's going to be the way to go to help us reduce the amount of antibiotic resistance, because we're just treating blindly. The resistance panel actually comes with you can actually do it with upper endoscopy with the biopsy tissue. They can test it, or you can even do it through stool.
Oh, so, okay. Yeah. So you can test. So you would first make sure they took the antibiotics right, and then you would make sure that the treatment is the right treatment, like there's no resistance from this bacteria. And then I think, if you identify that they did everything right, after how many rounds would you keep treating this person again and again? Like if they did everything okay? Because we have had a couple of those patients who did everything right. When would you stop?
I would say we would stop. I wouldn't say like by the second time, because if we did our work and we did target to treat, but it still didn't work, we wonder, why did they become positive? Yeah. So then I would stop there.
Yeah.
But then I kind of, well, how would you treat them afterwards?
Yeah, I mean, I think digging deeper is really important, instead of just keep pounding them with antibiotics and then eventually they get some kind of other GI issue or kidney issue from antibiotics. But the one thing that we always forget about is the mouth. You want to make sure the mouth is clean, because the mouth is a place that can also harbor H. pylori. So if there's poor dental hygiene, and even if you treat, but the mouth, whatever is, like, it could be gingivitis, it could be abscess or something. If that's not fixed, there's going to be recurrent infection, right? Also, you kind of want to look at the family members. Like, are they eating using the same spoon, kissing? Like, is their spouse have H. pylori? And so they keep getting reinfected and reinfected and reinfected. So that has to be addressed. And then, of course, you kind of want to look at what the stresses are in their life. Because if there is high either chemical, emotional, or physical stress, if the stress issue is not resolved, I'm not sure you can really, really completely treat any kind of immune-related disease, right? So I think we have to and that's where I think functional medicine goes that step further. Like, what is going on in this person's life? Looking at diet and nutrition. If you put someone on antibiotic and then, they're eating like burgers and from fast food and everything, is that really, really going to help restore that gut microbiome? Yeah. I think that's important. We have a question now that, how true is it now that colonoscopy that was done before is now done only with blood test? Is this right? No, we're on a different topic now, but the blood test sensitivity, which is, I think, is the Septin 9 for detecting colon cancer, is only in the 70% or even less sensitive and specific. So that is not the test that we rely on for diagnosing colon cancer, but we are talking about, that's a different topic. That is true. There's a question, Donna, that is Donna another functional medicine provider? I mean, she's getting there, because it looks like I'm winning the debate. But I mean, I know that in our practice, we definitely encourage the use of probiotics, gut restoration, after the use of antibiotics. So we'll use things like glutamine, zinc, carnosine. Zinc carnosine, we'll use slippery elm. We'll put good probiotics on marshmallow root. We'll put good probiotics on for at least 1 to 3 months, just to support someone after antibiotic treatment, if we did have to give antibiotic treatment. But if we decide not to give antibiotic treatment and the person decides to go sort of more functional medicine, then we use our regimens like the mastic gum. And I've done a lot of research on the dosing that I want to use: biocidin, Pyloricil, GI Revive. We follow the 5R protocol focusing on the HPA axis, removing the stressors, and all of those other things.
And that's usually more involved with like closer follow-ups, and just because the treatment's even longer than 2 weeks of antibiotics and then you're done.
Exactly. Yeah. And I looked at some of the data. There isn't a ton out there, but there is actually a New England Journal data on the mastic gum and manuka honey, and the results were not bad. But long-term use, we're looking at eradication around 60 to 65%. Which is not bad, but if you look at our conventional treatments with like Pylori and the conventional antibiotics, we're looking at what, more like 90%. Yeah. And so sometimes some people opt not to take the prescription medication, and I think especially when it's chronic GI symptoms, especially. So, I mean, for me, the learning point was actually try doing stool testing on anyone who is willing to do stool testing. And I think I'm going to be a little bit more aggressive than treating H. pylori whenever it pops up red on our specific comprehensive stool test, even if there are other issues, because the data also says sometimes when you treat the H. pylori, the dysbiosis goes away, right? The dysbiosis is caused by the H. pylori. So treating H. pylori sometimes also just treats the SIBO. So I'm going to be a little bit more aggressive with my functional medicine patients and trying to target that H. pylori, but not with prescription antibiotic.
Yep.
Doing it as part of the 5R protocol. Did we have any other questions? Was there anything else?
I think we got everything.
I think we covered everything. Guys, if you found this helpful, please type in H. pylori. Share this with friends and family. If you think you have had H. pylori and it's still bothering you, you may need to do that stool test. Maybe it was not completely treated. You always have to test and make sure it's gone. I think that's helpful, right?
Yes,
so
always. We always want to make sure.
Make sure it's eradicated during the breath test or the stool test. And one big pointer we did not bring up is that H. pylori causes in the acute setting causes high stomach acid, but in the chronic setting causes low stomach acid. And this low stomach acid, yes, when it's chronic, it causes low stomach acid. So you may actually need some acid if you've had it for a long time. And this low stomach acid can cause many issues, as we know. Hypochlorhydria causes SIBO, dysbiosis. It can cause malabsorption of protein, like you don't digest protein because you don't make digestive enzymes. So if you're not making amino acids, you can't make neurotransmitters, which affect your brain. You can't make insulin. I mean, there's so many things that you can't make if you're not making amino acids. That's why we see the iron deficiency and also see the vitamin B12 deficiency. So part of the treatment from a functional medicine standpoint is also giving a little bit of acid in our low acid states with digestive enzymes to bring back that function of the digestive tract. So that's a really important part.
Another point to make is
that for me or for you?
No, just for everybody, just so that they know.
Yeah.
Well, generally, one big sign is, well, I take acid medication, right? And we wonder, well, why are you still taking it? Why do you have to still rely on it? If you can't even wean off of it, then that's a problem. We need to get tested. We need to make sure this is not we're suppressing this H. pylori this whole time too. So that's the point I just wanted to make.
That is true. I mean, the treatment with the acid blocker medications is just for 2 weeks in the acute setting, right? And you don't want to do it for longer because you don't want to cause super low stomach acid, which will cause other problems too. So making sure you're taking the probiotics and everything, getting off those medications is really, really important. And it's a very important bacteria. The treatment of H. pylori has significantly reduced the number of peptic ulcer disease and the deaths that they used to see like 30, 40 years ago from peptic ulcer disease, significantly reduced now because we identify H. pylori not just as an ulcer-forming bacteria, but also as a cancer-forming bacteria. Mm-hmm. So eradicating it in the acute setting is really, really important. We have seen definitely it has made a big change in the world of gastroenterology, right? Being able to treat it. So, guys, we hope this was helpful information. Let me see. Well, they said everyone said it was very interesting. Oh, can drinking alkaline water daily affect H. pylori? I think so. I mean, if you have chronic H. pylori, we're saying you already have low stomach acid, right?
Mhm.
So we actually want to give you some acid to make sure the digestive tract is working better. Donna, I think you did a fantastic job. I'm convinced that we have to treat acute H. pylori. And I think I was able to convince you that we have to treat chronic H.
Chronic.
pylori, but without prescription antibiotics, going the more natural route.
There's a time and place for each of them. Yeah.
There is a time and place, and everyone is different. And I think that's the big plus about functional medicine. It's very personalized to who you are as an individual, your genetics, your diet, your lifestyle, your stressors. So we wanted to share that with you guys. I hope this was helpful. Donna, I hope you had fun.
I learned a lot.
I learned a lot from you too. You guys have a wonderful evening. Share this with friends and family. And if you watch this on the replay, enjoy. Continue to ask questions because we will continue to answer them. Have a wonderful evening, guys.
Bye. Good night.
Bye. Bye, Donna.